Hello, ladies. I think we've got this figured out. Was experiencing a little bit of a technical difficulty with, um, anyway, getting on here with the right uh, video. Okay, so I think we're good to go. Let me see if I've got you coming in through my feed here. All right. Yeah, I think we are good to go. All right. It's always a little nerve-wracking when you have technical difficulties, but hey, away we go. So, welcome to Wellness Wednesday, ladies. It's good to be with you again. I do need to go ahead and say my disclaimer while we let those all you ladies who want to get on and get ready for today's exciting topic. Anything that I say tonight is just health information and should not be considered health advice. Do not start taking, stop taking, or change the way you're taking any of your medications. And if you feel the need to do so, please consult your prescribing practitioner so that they can make the appropriate adjustments. And attending this Wellness Wednesday does not establish a doctor-patient relationship. All right, there you have it. How many of you knew that irritable bowel syndrome could be a symptom of low thyroid? How many of you suffer with that? And you don't have to answer this, but it's a very common thing. The definition of irritable bowel syndrome is that it is a group of symptoms that occur together, usually including frequent or repeated pain in your abdomen and changes in your bowel movements. Did I mention we're going to just talk about bowels and poop tonight? That's the topic. So just wanting you to know we're going to be talking about this for the rest of the time. So anyway, changes in your bowel movements, which would include diarrhea, constipation, or both. With irritable bowel syndrome, or IBS, you have these symptoms without any visible signs of damage in your digestive tract. So what I mean by that is on colonoscopy or some sort of endoscopy, there would not be any visible damage seen in the digestive tract. So IBD, inflammatory bowel disease, is a bit different and is basically the continuation of IBS that goes, unfettered. It goes undiagnosed or ignored or just not truly taken care of. All right, so IBD would be Crohn's disease or ulcerative colitis. I am not going to be talking about those per se necessarily, but just know that those conditions would be are conditions that you would see damage or disease in the digestive tract. Notice the name irritable bowel syndrome versus inflammatory bowel disease. Of course, that's what medicine's really good at finding, is disease, and they do that with tests. So endoscopy, including colonoscopies and so forth, again would be the way that they would be able to see damage, visible inflammation in your digestive tract. So that then, and there are some other methods of diagnosis that I'm not going to get into either, but that's what would characterize inflammatory bowel disease. Okay, so back to IBS. studies show that about 10 to 15% of people in the United States have it. IBS is more common in women, with almost twice as many women having it than men. Let's talk about the symptoms. So, abdominal pain. A lot of times it can be sharp pain. It can be very, very uncomfortable. It can roam around. It can be in different places in the abdomen. The differential diagnosis or the possible diagnoses of someone with abdominal pain vary widely. So that's why this is characterized by repeated pain that doesn't necessarily last a long time, but it's repeated, so there's a pattern to it. All right, changes to bowel movements, diarrhea, constipation, or both. So let's define diarrhea. Diarrhea, the definition of diarrhea is increased frequency of bowel movements, okay? Normal frequency is 2 to 3 bowel movements per day. Yep, you may not have known that, but every time you eat a meal, you should, that should stimulate a bowel movement. Or you should wake up in the morning, have a bowel movement, and have 1 to 2 more throughout the day. That is normal frequency of bowel movement. So diarrhea is more than that. The definition doesn't even mean that it's runny or loose. We actually describe those as soft stools or watery stools. So the actual definition of diarrhea is increased frequency of bowel movements. Okay, I think I've beat that one like a dead horse. All right, constipation. Well, that's decreased frequency of bowel movements, right? Less than 2 to 3 bowel movements a day. There you have it. So constipation is it's a well-known symptom of low thyroid, hypothyroid, and when you switch between the two of these states, switch between diarrhea, constipation, that is characteristic of IBS, all right? And this can be at any, you could have diarrhea type stools for, weeks, and then have a couple of weeks where you just don't go very frequently. So any combination of changes or changes in the frequency of the bowel habits that you're having is characteristic of IBS. IBS is commonly characterized by bloating and gas. Yeah. So gas meaning burping or flatulence, but most notably, increased flatulence. Bloating is, I think those of you who have dealt with bloating know exactly what I'm talking about when I say that. It's just a pressure that you feel inside the abdomen. Sometimes it even distends your abdomen, so it makes it pop out a little more firmly. So this is caused by certain gases produced in the small intestines and sometimes the large bowel, but most often the small intestines, caused by certain bacteria when they are present. Okay, and it just can be very uncomfortable, and it's, it pushes on other organs, and it can be very uncomfortable and cause some other issues. Okay, Food intolerance. It when you have IBS, many of you that have this would tend to notice um, foods that just don't make you feel good, or they cause more bloating and cause more gas, or you notice a change in frequency right away with a certain food that unfortunately you may be intolerant to. So eating a certain food can cause an immediate wave of pain. She may, well, she's not going to know if I share too much, but my daughter, she will get I won't say which one, but she will say that she knows when she's had gluten right away because her stomach will hurt, and it can be very painful and uncomfortable for her. Or you could eat a food that causes you to have to get up to the bathroom right away, and you just dump. So, fatigue and difficulty sleeping. These are other symptoms of IBS. And so, why? Why would you have fatigue and difficulty sleeping? Well, it could certainly disrupt your sleep. The abdominal pain, the bloating could certainly disrupt your sleep, because while you are sleeping, your digestive system tends to work more. And so it's trying to take care of the contents in your intestine, inside. And when something is amiss with IBS, this can certainly disrupt your sleep, and certainly affect your energy levels the next day. So it certainly, yes, could cause a lot of fatigue that way. Another symptom of IBS can be increased blood glucose. So this can actually lead to insulin resistance, pre-diabetes and diabetes. If you are not eliminating properly, if you have more constipation, then this can cause toxins to recirculate over and over again, which increases inflammation, which increases insulin resistance, because cells get sicker and sicker that take on these toxins, and they can't express the right receptors for insulin and other hormones. So this truly can impact not just your metabolism, which certainly then can cause weight gain and low energy, but other chronic diseases. So this can lead to autoimmunity and Hashimoto's, starting with leaky gut as well, of course. And I did a whole Wellness Wednesday on that, so I'm not going to discuss that at all tonight, even though it is a gut-related topic. But please go back and search under the Wellness Wednesdays in the group page and watch that one again if you have questions about that. So, okay, causes of IBS. Obviously cramps, intestinal muscle contractions that feel very crampy, like I said, sometimes very sharp. This isn't really a cause, but it is a cause of the symptoms. So something is causing the intestines to cramp up, because they are made of smooth muscle. They push things along with a movement or a motion called peristalsis, and as it moves things along with the smooth muscles in the walls of the intestines, some of them can really cramp up, and this can be, like I said, very, very painful. So nervous system abnormalities certainly would lead to some of that. There is part of your nervous system that is called the parasympathetic nervous system, that the vagus nerve is largely the largest part of that. And it has so many branches off into all of your internal organs, but especially your digestive organs. And when you have sensitivities to foods, when you have inflammation and leaky gut, that can irritate that intestinal, what we call the enteric nervous system, and that will cause some of those cramps sometimes because the nerves will just kind of go crazy and start causing those muscles to cramp up. And it can then lead to brain issues, sinus issues, because it affects the mucosa of your sinuses. It can affect all the other organs that are connected to that parasympathetic nervous system. So your heart, your lungs. That's why some of you, when you have IBS symptoms, sometimes you notice palpitation, sometimes you notice pain, even up here in the chest, like you're having heartburn. There are all kinds of different weird symptoms you can have with this. So that all happens through this, through these nervous system abnormalities. And I will get to some of those questions at the end, all right? So, okay, I'm just noticing some of those. All right. Another cause could be infection, severe infections. So bacteria, yeast infections, parasites. So these can be very irritating to the intestines, can cause, and colon. This can certainly, so you've heard of colitis. There are infections of the colon, and then certainly SIBO, small intestinal bacterial overgrowth, can be kind of a more mild symptom or a mild infection, but still can cause irritation, and that will in turn cause the intestines to sometimes cramp up or to not work very well. Certainly this impacts the way your intestines can process the food, break down the food, digest, so you can digest and absorb your nutrients from your food. Because if this is impacting the way this paracelsus moves along, you might not, and if it's going too quickly through there, you're not going to absorb much at all, despite how much you eat, and you're going to be malnourished. So changes in gut microbes would be another cause of IBS. So, taking antibiotics that destroy some of the bacteria that you need in your gut can certainly lead to that imbalance, or it can change the the makeup of your microbiome. So that can lead to IBS. And then I already mentioned food sensitivities when I was talking about food intolerances, but basically food sensitivities, foods that you are not necessarily allergic to, but sensitive to. And I will be going into this in more detail for sure in the master class coming up in January, and I'll talk a little bit more about that at the end of this this presentation. But the food sensitivities, it's not an allergy even. It is just a food that maybe you don't digest very well. Maybe it's because of the herbicides and pesticides that come with it. Maybe it's a GMO, or and you're just sensitive to it. Maybe it's a preservative, monosodium glutamate, or autolyzed yeast extract, or natural flavors. These kinds of things can cause sensitivities. So these can certainly kick off IBS symptoms. So, okay, some other considerations for for IBS, especially as it relates to the role of diet and lifestyle in helping to control this. So if you realize that some of these causes really have a lot to do with your food intake, this means that really changing your diet is extremely important. And lifestyle, I always tell people, do like your mother said, chew your food. Don't drink a lot of water while you're eating, because then you dilute the digestive juices. And if you have to have something, just take sips. But yeah, don't drink hardly any while you eat. And just don't eat in a hurry. Sit there and enjoy your food. And certainly the impact of stress and other psychological factors can be really important factors in IBS. So we all know, that stress can impact the function of our gut. And, you've been nervous before, maybe, before you go for an interview or, give a speech in class, or, whatever you had to do. You felt those butterflies kind of in your stomach. Your intestines and bowels are your second brain. And in fact, more neurotransmitters are made in your gut than in your brain. So think about that. Neurotransmitters, meaning the chemicals, the neurochemicals that you need to have healthy moods, to avoid anxiety and depression, and you need these neurotransmitters. You need the bacteria that help you make them. So yes, certainly stress and the way you handle it can have a big impact on gut function and can cause IBS or impact IBS. And I just talked about the gut microbe balance. So having a balanced microbiome is key to reversing the symptoms of IBS, and they truly can be reversed. As we take all these things into consideration, addressing each of these things is extremely vital for helping to reverse IBS symptoms. And so also understanding that you may have food sensitivities, and choosing to not partake of those foods because you know what it's going to do to you, because you know that it will irritate your bowels, and just like the name says, irritable bowel syndrome. These are going to irritate your bowels, and small bowel, large bowel as well, and cause these symptoms and perpetuate the problem, perpetuate the inflammation that is not seen but is absolutely present, or you wouldn't have these symptoms. I need you to understand that IBS is caused by inflammation of the intestines, and it's just not that you can see it with a test. Okay? All right. So treatment. There are many different treatments out there. A lot of doctors just jump right to the medications. Take a laxative, or you do. You go to the local pharmacy, Rite Aid, Walgreens, and you find the laxative section, and so you try that. Or your doctor could prescribe an antispasmodic, Bentyl, dicyclamine, hyoscyamine. I mean, there are several that you might have heard of or might have been prescribed, as well as antidepressants, a very common treatment for irritable bowel syndrome, because they have they have side effects, and some of the side effects include um, either diarrhea or constipation. So um, when you have one or both from time to time, sometimes it just helps to take the Band-Aid, and because that's the way doctors are thinking. Well, you can solve this with a pill. They have all these other side effects, guys. It's those of you who really are starting to care what you put into your body, or those who really do care what you put into your body, and you're wondering, well, why do I have these symptoms? And if you haven't considered the dietary piece fully, or if you have just been offered medication, I mean, it sounds really really tempting to just get rid of the problem with a pill, but they come with a lot of other side effects, because what medications do is they utilize your resources, um, and it depletes them for other things that your body needs. So hence you have side effects. All right. Many of you might be tempted to take probiotics or prebiotics, and unfortunately, if you have an infection, or a major gut microbe imbalance, probiotics are not going to solve that problem, because alone, I should say, probiotics alone. And most of the time, you do much better actually treating the infection prior to introducing probiotics or prebiotics to help you build back up the flora that you need to be balanced, and that can help you do it in a balanced way. So it really depends on the understanding of your chosen practitioner. They really need to understand that there is an order to things, and certainly someone who knows how to help you with this would know that there are dietary changes necessary. In fact, some of them can be very extreme, like you've probably heard of the low FODMAP diet. Certainly gluten-free diets, dairy-free diets are extremely important, but the low FODMAP diet can be even more restrictive, and it's just not usually sustainable, but it may be necessary for a short time to get you out of the woods, so to speak. All right, then a knowledgeable practitioner would be able to help you with stress management techniques, recommending proper cognitive behavioral therapy perhaps, or help you with mindfulness, yoga, all important tools for managing stress, because we know what stress can do to your intestines. And certainly, last but not least, and probably the most important, would be proper natural therapies, herbal remedies for infections, parasites, yeast, aloe vera juice, even slippery elm tea can be really helpful when there's a lot of stomach irritation. Acupuncture can be helpful, and so these types of therapies, and you need to be guided by someone who is adept at administering these types of treatments. So, all right, I wanted to give a couple of examples of patients of mine who have done so well. I want to first tell you about Melanie. When she began her treatment program, she would be several days without having a bowel movement. So obviously, extreme constipation, when you need to have a bowel movement twice a day, twice to three times a day, she was going several days without. So after she went through her, after followed my thyroid repair blueprint and was able to go through her customized care program, she's now having 2 bowel movements a day, like clockwork. So feeling much better, by the way, in many other ways. better energy, better brain clarity, and she's down a lot of pounds, which is exactly what she was hoping for, over 60 pounds. So, all right, now Ida, she was having several bowel movements a day, multiple, and as we did comprehensive testing with her, um, we found on comprehensive stool testing that she had a blastocystis infection, which is blastocystis is a parasite, and she had been having this problem for several years. Was really trying to hydrate because she was having so frequent, such frequent bowel movements, upwards of 8 a day, and this after we found out what the problem was through comprehensive testing and the appropriate treatment for the parasite, her bowel movement frequency calmed way down to where she was having 3, maybe 4 sometimes per day, and which was much better for her, and she was able to also drop several pounds and just start feeling a lot better energy as well. So I just want to conclude with kind of it is so important to be able to understand why you're having these symptoms. Remember that symptoms are your body's warning signals that something is going on, all right? And we really need to pay attention to these, and as practitioners need to listen to our patients. And I know nobody likes to talk to their doctor about their poop, but I tell you what, it's a common theme every day, common topic every single day, because it is so important. If you are not draining properly, if you are having trouble with getting your waste out, it is this is causing toxins to recirculate and cause more and more inflammation and problems, including developing disease and certainly more symptoms. So and then if you're going too much, you're not digesting your food properly, you're not getting the benefit of your food properly, you're likely malnourished, and you're probably dealing with some other things, likely decreased energy, likely brain fog. I mean, these symptoms all kind of go together, but when we do comprehensive testing to find out what the problems are, we're going to understand that, well, if you're low thyroid, that can be a huge factor in this. Your gut, your GI tract or gastrointestinal tract needs thyroid hormone. Every cell in your body needs thyroid hormone. So you need thyroid hormone, and if you're not producing enough, if you happen to be low thyroid and you don't know it, and you only have these IBS symptoms, then you need comprehensive testing. All right, so the key there, like I said, to just summarize a few key points, IBS is characterized by repeated abdominal pain, sometimes cramping and sharp. It's characterized by changes in bowel habits. It's characterized by food intolerances. It's characterized sometimes by fatigue and poor sleep and some of the other symptoms I mentioned. Several causes include hypothyroidism, food sensitivities, stress, and abnormal muscle contractions, enteric nervous system issues. There are several causes that we just have to iron out. Parasite infections, bacterial infections, yeast infections. So lots of things to be tested for in order to find the root causes of this. It's absolutely vital that you would have a customized care plan to really help you address your root causes and get these symptoms under control. So, okay, well, there you have it. I am super excited as well to once again announce the masterclass. I know it's been put in the comments. Thank you, ladies, for putting the comments in the comments, the masterclass announcement and link to be able to register. So if you have not done so, please do so. It will be held January 15th through the 19th, and it'll be every evening for an hour and a half or so, starting at 8 p.m. Mountain Time, 7 Pacific. And I will be covering so much, certainly discussing why this is, these symptoms, these low thyroid symptoms that you're having, even if your labs are normal, even if you can't get your doctor to listen to you, even, this isn't in your head. It's happening. There are always causes, and we're going to discuss all of that, all of the the over 20 different mechanisms that cause low thyroid, and we're going to discuss why it's so difficult for you to lose weight, or those of you who can work so hard and lose a little weight and just to gain it all back, or those of you who can't gain weight. What's going on there, and is it a thyroid issue? So much to talk about in the class. So register and tune in live, because that's where you're going to get the best benefit, the most benefit out of it. And invite all your lady friends who have symptoms too, that those they're searching for answers as well, but maybe they don't know yet how to find it. We'll be talking about my thyroid repair blueprint, which includes the absolute importance of getting comprehensive testing to be able to reach your health goals and know what the plan needs to be. It's like the most important step. So, okay, now I do have a couple questions from today's topic. The one that I saw was, let me scroll down a little bit. Is IBS a symptom of MS? And actually, it can be if the vagus nerve is compromised by